Have you ever had a symptom and you've been wondering, is it okay if I stay home or call my doctor in the morning? Or this is really bad, I need to go to urgent care, or I have to go to the hospital right now. Sometimes it's really hard to know. Well, I'm Dr. Erica and I'm a board certified physician here to talk to you about some of the red flag symptoms that we see in our day-to-day practice that you might not want to blow off. So let's break them down for you in one of 5-part series. So obviously one of the big ones is chest pain, right? Everybody knows if we're concerned about a heart attack, we're usually going to see chest pain. So crushing, stabbing pain right here. It's not always what you want to look for though. Oftentimes, especially in women, we're going to see a pressure-like sensation on your chest. It feels like an elephant sitting there. No pain, just pressure. If you have that, that is a really worrisome sign that you might have a heart attack going on or something else intrathoracically that would need a doctor to see right away. And obviously don't blow off any chest pain. If you're having chest discomfort, you've got to go in right away. I mean, I had a patient who was lifting weights. He was young, he was in his 40s. He really didn't have any medical conditions. He came to see me and he said, you know what? I had some stabbing chest pain. It went away after a couple of minutes of lifting weights. And now I'm just having heartburn. So I can blow it off, right? No. I sent him right to the ER and sure enough, he was having an active heart attack. So thankfully the ambulance was able to take him and take care of him right away. So heartburn, often people will say, oh, I just felt like I had an upset stomach or heartburn. Not necessarily the case. So if you're having a lot of discomfort, that's something to not blow off. Dyspnea on exertion. Okay, this is a huge one. The classic thing that we always get in our board books is somebody was shoveling snow and as they were exercising, they had a really hard time breathing or they had chest discomfort. Well, it's not just super strenuous activity. What if you just get up around the house and you're really struggling to breathe and this isn't your norm, right? This isn't your baseline. Trouble breathing with exertion is a sign that you might have a blockage in one of your blood vessels, especially around the heart. And if that's going on, it can lead to a heart attack. So that is something you absolutely cannot blow off. Another medical word that I really like, I don't know, we have a lot of weird medical words, right? Well, it's called orthopnea. Orthopnea basically means you're having a hard time breathing when you lie back. Now, why does this make a difference? Well, if you have a lot of fluid around your heart or something called CHF, congestive heart failure, when you lie back, gravity puts more pressure on you and it makes it really hard to breathe. If you're having a CHF flare, one of the first things that a patient might say is, wow, you know what? I tried to recline or just lie down for bed and I could not breathe. Orthopnea is a really scary thing. It's not something to just blow off and deal with, something you absolutely want to talk to your doctor about. If it's sudden, meaning you haven't had it kind of going on day by day and it happens overnight, you need to go in right away because there's a reason you can't breathe and we need to figure it out. And then the last thing that I'm going to talk about in this first of 5-part series is sudden significant weight gain. And I'm not talking about a little bit. I'm talking about like 5-10 pounds overnight. Yeah, you actually can gain that much that short of time with water gain, right? Well, why would we get so much water and fluid overload? People with congestive heart failure might have this as a sign and an early stage of heart failure when it's an acute exacerbation, meaning they go to bed, they wake up and they are so swollen and they have significant weight gain or a lot of times a lot of puffiness or edema in their legs. If this happens to you, that is something that you need to speak to your doctor about right away. If you liked this video and found it informative, be sure to like and follow and look for my other videos where I explain other red flag symptoms on things that you don't want to ignore but need to be seen by a doctor right away.